and it aids to patient safety, decision making, and in critical moments, the ability to see is the ability to save the life. So thank you so much. Keep rolling. Thank you.
Yes, sir.
Thank you so much. And for the diagnosing of hypovolemia, we can make a quick diagnosis. Pneumothorax definitely is quickly diagnosis is made by a focus. And for the thrombosis, even for the quick diagnosis of pulmonary embolism, focus is a very good modality of choice. So the golden rule which we have to remember regarding focus, it should be done within the time period of 10 seconds when we are checking for the pulse of the patient. We should scan elsewhere during the CPR because subsidiary window is the only window which we can actually scan through. And also we need to appoint a timekeeper. The timekeeper will say 1, 2, 3, 4, 5, 6 and now it is the time for focus. And also it provides us rapid assessment. There are some lacunae also, limitations also in this procedures. For example, the patient is in the lateral position. So this is not a very right thing for us to make a good window. So, but there are some caveats. We can go ahead with such cases also with some modifications. But definitely it is not a very good patient for the novice. So many societies, even our ISA, Royal College of Anesthetists, and many big societies, they have come up that we must train our anesthesiologists with the focus training. And there are also assessment checklists which we assess our trainees on the focus knowledge.
Organizing committee for giving me an opportunity for this talk. So all of you are in your postprandial state, and so imagine you are going to the OR today, and then there is a virtual assistant for you who is telling you, okay, this patient is, this is a pre-op evaluation of this patient, and the patient is at risk of hypotension. Would you be happy to listen to a virtual assistant telling you that, or won't you be? Won't you be? So that is what I'll be talking about today. Artificial intelligence in anesthesia, is it a boon or a pain? So I'll be talking about briefly about AI versus human intelligence, the pillars of AI and its applications in the perioperative phase, academics and research, and SWOT analysis for all of this, and a bit about ethics and future. So basically, AI is anything which is being from a computer that can work like a human. So what are the components of humans? The human can learn, a human can reason, and then the human can do problem solving. The same things artificial intelligence can also do. Now, what is the difference between humans and AIs? So the basic units of AIs are transistors.
Okay, good morning. I am Dr. Pandu Naik, organizing chairperson of this Yuvacon National. Yuvacon National is anesthesia conference, national conference. So in this conference, all the delegates throughout India as well as Telangana, Andhra and other states, everybody will come for this anesthesia national conference. So for this conference, around 1500 delegates are registered. So the purpose of this conference is to share the knowledge and the skills among each individual. So many efficient speakers and the senior people will come for this conference to promote, especially for the youngsters, because in our society around more than 50 to 60% people are youngsters. So they are the right person to cater the needs of the society and medical care services throughout India and abroad. So to update the latest techniques and latest changes coming in the medical field, so it will be updated in this type of conference. To promote this, we have designed the scientific theme in such a way that it should be very useful for every individual, and ultimately the patient care services will be provided, improved in India and particularly in Telangana. So from this conference is giving the idea of to take care from rural area to all the critical and the tertiary care hospitals, what sort of services we are providing. So especially pain relieving techniques, critical care, and regular super specialty and basic specialty services. All these things will be discussed in this conference, and the techniques of anesthesia, providing safe anesthesia is the main motto of this conference, and ultimately youngsters will get benefited by experience of the senior people, experienced people throughout India. So so many senior people will came for this conference, national figures, national secretary, national president, national treasurers. In addition to that, Telangana and state body as well as the Hyderabad's organizing team. So everybody has participated and made this conference very successful. Ultimately, patient care services has to be improved. The services should be in such a way that no patient should feel pain during anesthesia or during any surgeries, and all critical care cases has to be handled in such a way so that there won't be any morbidity and mortality. So ultimately, patient care services will be improved. That is the conference idea of this conference. Thank you. So for this conference, our national president, Dr. Bala Venkat came, and secretary national, Dr. Sukhminder Singh Bajwa, and treasurer and vice presidents of national figures. Everybody will came to address this conference, and they gave the idea and their experiences to the junior colleagues to improve the patient care. Thank you. Thank you. Around 1,500 delegates have participated in this conference. So being a organizing chairperson, I'm Dr. Pandu Naik. So we have, along with my team, so we have conducted this event. So everybody participated, and they are getting most benefited clinical and other services from this conference. Thank you.
Warm greetings to all, and I am Dr. Aditya, co-organizing secretary for this conference. This conference we are conducting is the National Yuvacon conference and the Telangana State Conference combined together, with the participation of over 1,300 delegates, that is 1,300 doctors all over India. So this is regarding the new concepts in anesthesia and better safety prospects and how the advancements are made in anesthesia. The message what we want to give is clear, that the rapid changes in the health benefits in this country are only happening because of the advancements in anesthesia. So whatever complicated procedures you are able to do, today India stands tall as a medical hub for a lot of medical procedures is only because the anesthesia practice has been made more scientific and more precise, where the safety has been the best that has been possible. So we hope that we try to gain more concepts and try to help people with more better facilities as well as scientific advances for a better outcome. Thank you. Sir, this is basically a 3-day total program, where one day we had workshops. So we had 5 different workshops at 5 different hospitals in Hyderabad. That included Sindhu Hospital at High-Tech City, Ananda Rehab Center at Begumpet, ESI Medical College, ESI, Usmania Medical College, as well as Nizam's Institute of Medical Sciences, where we had 5 different workshops where more than 400 delegates participated all over the country. And today we have the conference that is on Saturday and Sunday, where we are going to see more than 400 papers being presented. So we hope that the awareness that comes and the enlightenment that will come, that will help the better society better. By our national president, Dr. Bala Venkat sir.
Any presentations on the file? Already certificate.
లోపల ఉన్న అనస్థిస్టుల కోసం, యంగ్ అనస్థిస్టుల కోసం ప్రత్యేకంగా నిర్వహించే నేషనల్ లెవెల్ కాన్ఫరెన్స్. దీంట్లో దేశవ్యాప్తంగా వివిధ రాష్ట్రాల నుంచి 1,200 మందికి పైగా డెలిగేట్లు అటెండ్ కావడం జరిగింది. దీంట్లో నిన్న మొదటి రోజు వర్క్షాప్ నిర్వహించడం జరిగింది. అంటే దాంట్లో కొత్త మెలకువలు యంగ్ అనస్థిషియాలజిస్టులకు నేర్పించడం. రెండవది ఈరోజు రేపు న్యూ టాపిక్స్ మీద అకాడమిక్ వాళ్ళకు నేర్పించడం జరుగుతుంది, లేటెస్ట్ డెవలప్మెంట్స్ వాటి మీద. ఇట్లాంటి కార్యక్రమానికి మాకు నేషనల్ లెవెల్ నుంచి మా నేషనల్ ప్రెసిడెంట్, నేషనల్ సెక్రటరీ, అండ్ నేషనల్ ట్రెజరర్, జీసీ మెంబర్స్, లోకల్ హైదరాబాద్ నుంచి నేషనల్ జీసీ కోఆర్డినేటర్ రామకృష్ణారెడ్డి, వీళ్ళందరూ కలిసి హైదరాబాద్లో ఇట్లాంటి కార్యక్రమాన్ని నిర్వహించాలని పెట్టినారు. దానికి మేమందరం కలిసి ఆర్గనైజింగ్ టీమ్ అండ్ స్టేట్ బాడీ అందరం కలిసి 3 రోజుల ఈ కార్యక్రమాన్ని ఇక్కడ జలవిహారంలో నిర్వహిస్తాం.
డెవలప్మెంట్స్ తర్వాత ఇప్పుడున్న వాటి గురించి బాగా కూలంకషంగా మేము డిస్కషన్ చేయడం జరుగుతుంది. దేశవ్యాప్తంగా వివిధ రాష్ట్రాల నుంచి దాదాపుగా 1500 మంది మత్తు వైద్యులు పాల్గొన్నారు. తెలంగాణ రాష్ట్ర స్థాయి సదస్సు కూడా ఇది, మరియు యువ మత్తు వైద్యుల జాతీయ సదస్సు. సో ఇది అందరికీ ఉపయోగకరంగా ఉంటుంది. తర్వాత ఇది మునుపెన్నడూ లేని విధంగా భారీ ఎత్తున హైదరాబాద్లో నిర్వహించడం జరిగింది. దీనికి మత్తు వైద్యుల సంఘం జాతీయ అధ్యక్షుడు డాక్టర్ బాల వెంకట్, తర్వాత కార్యదర్శి డాక్టర్ బాజ్వా కూడా హాజరయ్యారు. థ్యాంక్ యూ.
ఆల్ స్టేట్స్ త్రూఅవుట్ ఇండియా, ఆల్ స్టేట్స్ నుంచి డెలిగేట్స్ వచ్చారు. థ్యాంక్ యూ.